Hi, this is Dr. Kim. So today I want to talk about using low-dose naltrexone and insomnia, which is this is the next part to it. And in this part, I want to talk about another way that um, LDN works. The LDN, of course, it works as an opioid antagonist, and it tends to reduce inflammation for neuroinflammatory and immune system, and that's one of the mechanisms I think that can LDN can help people to sleep, and I favor that approach because it also helps to have people fall asleep. It helps for people to have less sleep disruptions. It helps people to have better quality of REM sleep, as evidenced by more vivid dream. The only side effect would be that if people have um, PTSD or nightmare, then that part may not work as well for that individual. So we talked about a situation where the person was taking it um, and first slept really well and stopped getting the benefit. So we talked about one of the things that they can do is they can talk to the provider and think about either increasing the dose more frequent, dinner time and nighttime, or just taking it at nighttime or morning time and evening time. And the timing of those things do different things. But there's another way that I do think is a very elegant way is to use another toll. LDN also works as a toll-like receptor antagonist. That means that it acts as a something that will interfere with toll-like 4 receptor. And there are other toll-like receptor for antagonists in nature as well as with medication. So one of them actually is amitriptyline. So amitriptyline is a medication. It is used to use in low doses. It can be helpful for sleeping, and the side effect, depending on people, can be less. And we'll talk about another agent another time. But amitriptyline, I do like it because it is a toll-like receptor antagonist, just like LDN, so that it inhibits the toll-like receptor 4 activation on glial cells. It suppresses the downstream cytokine production, modulates microglial activity, and reduces central sensitization. It also helps with neuropathic pain. It helps with sleeping. It helps with mood. So the Paracelsus, a Roman philosopher and early pharmacist, pharmacologist, pharmacist, said that dose makes poison. That means that the usual dose of amitriptyline, 25 milligram, probably is too high for most people, especially people who are very sensitive. So I tend to dose the LDN and amitriptyline about the same dose. So if someone is taking 4.5 milligrams of LDN, I'll often write for a compounded medicine for amitriptyline for about 5 milligrams, and that seems to work very well. So this is not an FDA approved indication, just like LDN. But if people have pain, insomnia, and other inflammatory disorders, I think that combining these two does make sense. And we'll talk about other ways to improve insomnia, which actually I think works even better than this approach. If you've learned something or you find it interesting, please give me a like and share. Thank you.